Fuck, kill, spread death and destruction as they destroy. And we still do as we are told. Well, they make laws and pass bills.
This is Steve Zeltzer with WorkWeek, and I'm joined now by Joe Maniscalo. He is one of the editors and founders of WorkBites in New York City, an online news journal that has been covering the important issue of healthcare and Medicare Advantage and the struggle of New York workers, particularly public workers, to protect their healthcare benefits. Welcome to our show, Joe.
Thanks, Steve. Thanks for having me.
So, Joe, you've been on this story about the city workers' unions and their secret plan to basically allow for the city to not pay for healthcare by transferring them into Medicare Advantage and a system which is not benefited city workers. So why don't you talk about how the story began?
The first thing to realize is that the city of New York has been covering its employees Medicare for like 60 years. It's one of the reasons why people are always told, yeah, do what you want to do, but always have a fallback, always have a good city job. That's what made a good city job, is that you would know that once you retire, you would have medical coverage. The city would pick up that 20% of that Medicare was never designed to cover, right? But since like 2014, in the aftermath of the Bloomberg years, when none of the union contracts were settled and nobody got a raise, they hatched this scheme under former Mayor DeBlasio to save the city $600 million a year in Medicare costs by pushing everybody into Medicare Advantage, taking the responsibility, off the city, giving it to the private companies, and then everybody, would get a raise. UFT teachers mostly would get a raise. So that's how this whole thing started. But
go on. So they basically, for a wage increase, the city union said, let's basically lower the standards of the benefits of the retirees.
Yeah, to surrender that Medicare benefit that, right? Remember, right? 1965, when it came in, how did it happen? With labor support, pushed it over the top, made it a reality. Now, fast forward to today, and that's out the window. Nobody ever thinks about that anymore. All I hear is like, this is the way of the world, Joe. We have to deal with these insurance companies.
And so when members began to find out about it, because apparently it was kept a secret from the members and the retirees, how did that happen?
It was just retirees, like the most vulnerable, but the most courageous people ever, just getting together, organizing. Because who did they do this to? They did this to lifelong trade unionists. So they knew how to organize. And that's what they did. They organized into organizations. And for the last 3.5 years, they've been fighting on the streets, in the halls of power, in the court. One organization that's been leading the fight in the courts is the New York City Organization of Public Service Retirees. They've won positive rulings in their favor 10 times in a row. And yet you still have the mayor of the city trying to push it with the support of the heads of the big public service sector unions.
And these union officials, why don't you talk about them? Because apparently they even put a retirees chapter, AFSCME, in trusteeship, which had been supporting a campaign to defend their healthcare benefits.
They raided their offices, Steve, in February. AFSCME raided the retiree organization offices in February and took it over. And that was, they'll say differently, but that's a direct result of the retiree organization association backing the New York City Organization of Public Service Retirees and in their fight against the privatization push.
And of course, members did not know about it. And one of the unions you recently covered, the Transport Workers Union, where the president apparently is denying that this actually is an attack on their members.
Yeah, I mean, he just pushed everybody at the beginning of this year. That went into effect. So he's still gaslighting everybody, telling everybody that Medicare Advantage is the greatest thing since sliced bread. It's an enhancement of benefits. Great if you don't really want to use your healthcare. But now, especially out-of-state transit workers retired and gone to Arizona or other places, they find out, oh, I can't even use this. I can't use this to get the care that I need. I can't get the operation that my wife needs, or I have to be put through this stress and turmoil of waiting, going through all these prior authorizations, and ultimately you could get denied.
And also, one of the unions in the public employees group in New York is the Teamsters. Apparently, the Teamsters head in New York was on a board, an insurance board that was there. I mean, that they're insurance boards that these officials are part of.
Yeah, I know the person you're talking about. I don't remember which of the insurance companies now, but yeah, that's also true. But then, like, we're talking about transit workers, right? You have another union that represents supervisors, basically across all the titles in the transit system, and he says categorically, "You're not getting our Medicare MTA." I don't care what the other union did, but I don't. It's very emotional and personal for him. He's very, very passionate about it. It's like, not only am I not giving it up at the bargaining table, but we're going to change our bylaws to make sure that anybody that comes in after me is not going to be able to give it away. And he's like, I don't have any respect for these union leaders that have done this. They shouldn't be union leaders, is what he tells me.
And this Medicare Advantage, isn't it the case that the AFL-CIO national unions are actually advertising Medicare Advantage on their websites, have contracts with these insurance companies, Anthem and others, for Medicare Advantage, and basically getting money for the unions from privatization of Medicare?
Yeah, that's part of it too. Let's rewind before the SAG-AFTRA went on strike. Medical was a major problem for that union. That's what caused a schism. And what happened as a result of that? They enrolled their own Medicare Advantage plan, putting all their members, into Medicare Advantage.
And so they were ended up with cuts.
So they ended up with this great Medicare Advantage plan that's subject to prior authorization, delays, denials, and a ever dwindling pool of participating doctors and hospitals.
And the Democrats, who were in the majority, allowed for Medicare Advantage. They said it was going to cover services and other things that were not covered by Medicare. You think that was really a sham argument to push privatization of Medicare?
Absolutely, absolutely. People really are ardent about Medicare for all, enhancing Medicare. And that's pie in the sky at this stage still. And yet this, to privatize everything, that's just taken as a matter of course.
And of course, the assassination of the head of United Healthcare has opened up a lot of investigation of United Healthcare, and the fact that it's a vertically organized company that controls the doctors, controls the service providers, controls the payers, controls drug companies, that they control the largest part of Medicare is done now through United Healthcare. And they're making billions of dollars, as well as other providers for Medicare. Where do you think this is going? Because it seems like these companies really want to completely destroy and privatize Medicare, and that's what's happening in front of our faces. And it doesn't seem to be an issue within the AFL-CIO, the Teamsters, or any of these unions.
Yeah, I mean, it's going to happen if people don't become aware that it's happening and decide to follow the New York City retirees' example. Get up, get out into the street and organize against it. It's going to happen.
Well, it started with the retirees, but apparently now they're pushing it on the members of these unions.
Yeah, I mean, they've been saying that from the very beginning. It's like, listen, this is happening to us, but everybody on the job, you're a retiree in training. What is happening to us is going to happen to you. So little by little, you're starting to see, like, all the rallies that I go to now, there's plenty of young people in their 20s who are getting it and saying, like, that's not right, what's happening to you. And I see that that's what's in store for me, when my time comes.
What has been the reaction to your coverage of it? Because your journal has really been the most important journal covering.
Yeah, I mean, we have an impact on the people that we report on. I mean, I think they're very appreciative, but we're a microscopic organization. We're trying to build, so our reach, the biggest accomplishment for me is like when I get a larger outlet, picking up a story and running with it, that, and it could amplify what we're doing. But we're very tiny, and we need to build.
And your journal is located at work-bites.com. Why did you start this journal?
Right. Well, I was covering the labor beat for a solid decade in New York City until the day when I started writing about this, and I was told by the publisher, "You can't do it, Joe. You can't ruffle any feathers like that. Labor leaders won't like it." So it was like basically, Steve, they were asking me to commit journalistic malpractice, and I was like, "I'm not making any money at this game. This is the only thing I have is my integrity. So see you later." And yeah, so I just started out in fall of 2022. Steve Wishnier, who also worked with me at this outlet for a long time, came with me in strong solidarity. And another journalist, very veteran journalist here in New York City, Bob Henley, also came aboard, and we just launched this, with no money, and just said, "Listen, we're going to do it. We're going to build it, and they will come afterwards."
And one of the issues of healthcare, a lot of unions are that is fighting around that issue of healthcare, and a lot of their gains, wages go to healthcare companies. And this has become a national issue because the companies now are saying you have to go into our privatized healthcare plans that we run, not the union run plans. Do you think that's going to threaten the whole union structure of healthcare in the United States? Because a lot of unions have said they should join the union because they're going to get health care. But if everybody's in a Medicare Advantage plan or a privatized plan, what difference does it make?
Absolutely. I mean, that's another point that we brought out in the very beginning, and retiree stress is like, this undermines the labor movement. No one is going to want to join a union if they know that they don't have good coverage, that they're forced into this crappy plans, either when they're an active worker or when it comes to retire. That's the most galling thing. Is like, these are people who earn these benefits. That's why they came on the job as a public servant, knowing that they're going to get this Medicare. They paid into it. And now they turn around and their union leaders have surrendered their benefits. They don't even have a voice.
And nationally, the Democratic Party, the unions, Randy Weingarten, who's on the National Committee of the Democratic Party, voted against Medicare for All. April Verrett, who's president of the SEIU, previously was president of 2015 in California, largest local, 400,000. That local has opposed healthcare for all, Medicare for all in California, single payer. It seems like these officials have a vested interest in keeping the present system, which is benefiting the insurance companies and companies like United Healthcare.
Yeah, I mean, there's like a weird, it's one of the reasons why, the unions don't want to really push for Medicare for all, because they were like, this is one of the things that distinguish us, is that we have good healthcare already. So like, if everybody had good healthcare, why would you join the union? It's that level of logic that we're dealing with here.
Is that business unionism?
That is yeah, Class A business unionism. So I just got something back from the AFL-CIO, about this. And so they say, listen, we strongly oppose any effort to reduce beneficiary choice, including the choice of enrolling in traditional Medicare. Right? And we strongly support the expansion of traditional Medicare. Well, in New York City, the exact opposite has happened. Your unions are doing the exact opposite. They're totally contradicting you.
And if they have contracts with these private insurance companies to advertise Medicare for all, they're actually getting money for their members who sign up for Medicare for all. Aren't they actually pushing the privatization of Medicare by doing that?
Absolutely. Absolutely. There's no doubt about it. The city of New York is helping, is helping to put these they're actually helping these insurance companies get in touch with their municipal retirees living in other states.
And what has
That's-
been the backlash? I mean, there have been protests. Have any of these unions changed their positions?
Well, UFT here in New York City was spearheading this whole thing, but now they have officially backed off on the plan and split with the mayor on this. But that only happened after the UFT retirees took over the retiree chapter, and these are all people that formed into organizations over the last 3.5 years. The one I'm thinking about is CROC, the Cross Union Retirees Organizing Committee. They basically took over the UFD Retiree Association. And right after that happened, President Michael Mulgrew did an about face.
So they are having some effect. It's retirees organizing with other workers in their unions.
That's what's having the impact. That's what's having the impact.
Okay, well, I want to thank you very much for joining us. We've been talking with Joe Maniscalo. He is the editor and one of the founders of WorkBites, which is a journal which covers workers from the ground floor and has been an important resource to find out about what's going on with the attack on Medicare through Medicare Advantage and how that's hurting retirees and all workers. So thanks for joining us.
Thanks, Steve.